A woman, 36 years old, was first seen on June 26, 1978. The patient reported, 4 days after undergoing a tubal ligation surgery following childbirth in April 1977, she experienced vaginal bleeding. After more than a month of treatment, the bleeding stopped. However, she developed general body swelling and distension, and she would sweat heavily upon slight physical activity. While sweating, she felt a stinging pain in the sweat pores as if pricked by needles, which was relieved after the sweating ceased. The symptoms were initially mild but gradually worsened, and several treatments proved ineffective. The patient is obese and seems to be swollen, but when pressed, the skin shows no indentations and is pale yellow and shiny. Sweat is sticky, and small, slightly sunken dimples can be seen over many sweat pores, particularly on the shoulders, back, chest, abdomen, and upper limbs. Fever, slight sensitivity to cold, slight wheezing, and sometimes irritability, nausea, and a feeling of heaviness and weakness are all present, all of which worsen in the afternoon. No thirst, normal diet, normal bowel movements, slightly yellow urine. Pale, tender tongue, slightly fat, thin white coating, weak and slippery pulse. The doctor's opinion was that the patient had postpartum blood loss, leading to a deficiency of both qi and blood, followed by the invasion of wind. This resulted in the stagnation of sweat and dampness between the skin and muscle layers, leading to the above symptoms. The sweat and dampness blockage beneath the skin caused the sweat to be difficult to discharge smoothly, resulting in the needle-pricking pain in the pores. After sweating, the skin and muscle layers were slightly unblocked and the pain in the pores temporarily eased. The treatment method should be to remove the wind and dampness from the skin and muscle layers using Huáng Tāng as the basic prescription. Prescription: cinnamon twig, 9 grams, white peony root, 9 grams, Shizona petaspike, 6 grams, raw Astragalus root, 12 grams, honey fried licorice root, 6 grams, fresh ginger, 4 grams, jujube fruit, 3 pieces. This was a 1-day dose. The herbs were mixed and boiled into a decoction. The decoction was consumed twice daily. The doctor gave the patient 3 days of medicine in total. Second consultation, June 30th, 1978. The patient reported that after taking the medicine, the stinging pain in the sweat pores significantly decreased. The body no longer felt distended, and her spirits improved. However, fever persisted in the afternoon, and she still felt aversion to wind and cold after sweating. The doctor continued the previous prescription and gave the patient 3 more days of medicine. Third consultation, July 5th, 1978. The stinging pain in the sweat pores during sweating had disappeared, and the symptoms of fever and aversion to wind and cold had also vanished. The sunken depressions in the fine body hair areas had recovered, and the body no longer felt heavy or swollen. However, she still sweated excessively, and her face was yellow. The doctor considered that the patient had suffered postpartum blood loss and a prolonged illness, and should therefore tonify the body's qi and protect the skin and muscle layers from external wind and cold invasion. Prescription: ginseng, 6 grams, decocted separately, astragalus root, 10 grams, white Astragalus rhizome, stir-fried, 10 grams, psyllar root, 6 grams. 3 doses were given. After the patient consumed the medicine, the illness was completely cured. Notes: 1. Qi, a term in traditional Chinese medicine, referring to an extremely minute substance in the human body that is highly vital and operates incessantly. It includes the qi of breathing. Qi promotes and stimulates various physiological activities in the human body, including metabolism. The cessation of qi movement signifies the end of life. Some substances in the human body are constantly present, yet invisible, and some even exist only when the human body is alive, such as the qi of breathing. 2. Gui Jia Huáng Qi Tāng is the name of an ancient herbal prescription. Reflection: 1. Question for the audience. The case mentioned the symptoms worsened in the afternoon, which the doctor did not explain. The audience can consider why the symptoms would worsen in the afternoon.